मैं स्वागत कर रहा हूं RWS के मेंबर्स का, NGOs का, मार्केट एसोसिएशन और टेक्सटाइल मार्केट एसोसिएशन के साथ साथ अपनी एक्सटेंडेड हेल्थ एजुकेटर फैमिली का। हर बार की तरह इस बार भी सेशन 2 भागों में रहेगा। एक भाग में पहले डॉक्टर कालरा कोविड अपडेट देंगे, उसके बाद हमारा सेकंड सेशन शुरू होगा और सेकंड सेशन के स्पीकर रहेंगी डॉक्टर अंजलि अग्रवाल और उनका विषय रहेगा सेफ रिहैबिलिटेशन इन लॉन्ग कोविड। तो आइए आरंभ करते हैं आज के इस कार्यक्रम का। ओवर टू यू डॉक्टर कालरा। नमस्कार एंड वेलकम टू दिस शो।
नमस्कार। थैंक यू चावला जी। आप सभी उपस्थित व्यक्तियों का बहुत बहुत स्वागत इस सेशन में। और अब हम शुरू करते हैं अबाउट कोविड सिचुएशन। जैसा कि आप सभी जानते हैं, लेट मी शेयर माय स्क्रीन। ये विजिबल सबको?
जी जी जी।
अब पहले वर्ल्ड की बात करें। पूरे वर्ल्ड में इस हफ्ते एंडिंग ऑन 1st of February ओवरऑल न्यू केसेस में कमी रिपोर्ट की गई है। कमी जो है ये 2% की कमी कंपेयर टू प्रायर वीक। इससे पहले हफ्ते के मुकाबले इस हफ्ते 2% न्यू केसेस कम रिपोर्ट हुए हैं, और डेथ जो है वो 9% इंक्रीज हुई है पूरे वर्ल्ड में। ये डिफरेंट रीजन्स हैं WHO के। तो इस हफ्ते जो बढ़ोतरी देखी गई है ये यूरोप में 7%, यूरोप जहां नए केसेस 7% बढ़े हैं, वहां डेथ 2% कम हुई है। और अमेरिकाज में भी इस हफ्ते 20% केसेस कम देखे गए हैं, पर डेथ जो है अभी भी 16% कंपेयर टू प्रायर वीक ज्यादा हुई हैं। साउथ ईस्ट एशिया, जिसमें कि भारत का कंट्रीब्यूशन काफी था, अब जो है इस हफ्ते 8% कम न्यू केस रिपोर्ट गए हैं इस रीजन से, पर डेथ 41% इंक्रीज। वेस्टर्न पैसिफिक रीजन 37% इंक्रीज, ईस्टर्न मेडिटेरियन 24, अफ्रीका से 4% जो है इस हफ्ते कम केस रिपोर्ट हुए हैं, और डेथ भी जो है 7% जो है वो कम हुई है कंपेयर टू द प्रायर वीक। ये देखिए 3 महीने के ग्राफ में पूरे वर्ल्ड में ये डाउनवर्ड ट्रेंड थोड़ा सा पिछले कुछ दिनों से जो है थोड़ा सा हल्का डाउनवर्ड ट्रेंड शुरू हुआ है। और साउथ अफ्रीका, जहां से कि ये ओमिक्रॉन शुरू हुआ था, अब देखिए वहां पर फ्लैटनिंग ऑफ द कर्व वो हो चुकी है। वहां जो है पिछले जो है काफी दिनों से केसेस में कमी देखी जा रही है, और उम्मीद है कि ये कमी कंटिन्यूड रहेगी और वहां पर जो है स्थिति कंट्रोल में है। अब भारतवर्ष में पिछले 24 घंटे में भी बहुत कमी, या पिछले 4-5 दिनों से काफी कम केस देखे जा रहे हैं। 24 घंटों में सिर्फ 1,61,386 न्यू केस रिपोर्ट हुए कोरोना के, और पर डेथ 1733, क्योंकि इसमें से 1200 के करीब तो केरला से जो रिपोर्ट हुई है वो है। वैक्सीन की देखें तो अब जो है वैक्सीन हमारे देश में डोजेज जो है 167 करोड़ के लगभग ये एलिजिबल पॉपुलेशन में ये डोजेज खुराक दी जा चुकी हैं आज तक। और नीचे ग्राफ देख रहे हैं आप कि अब काफी दिनों से डाउनवर्ड ट्रेंड ऑलरेडी चल रहा है। पूरे देश में कोरोना के केसेस की कमी को देखा जा रहा है, जो कि एक अच्छा साइन है। लग रहा है कि थर्ड वेव अब ये समाप्ति की ओर है। और कंट्रीज में देखिए, यूएस में भी पिछले कुछ दिनों से, लगभग 2 हफ्तों से थोड़ा सा डाउनवर्ड ट्रेंड देखा जा रहा है। बट यूके में डाउनवर्ड ट्रेंड के बाद फिर केसेस में बढ़ोतरी देखी जा रही है कि यूके में 7 डे एवरेज न्यू केसेस की जो है 1 लाख, लगभग 2 लाख के करीब पर डे, ये जो है यूके में केसेस अभी भी देखे जा रहे हैं। ऑस्ट्रेलिया में डाउनवर्ड ट्रेंड आप देख रहे हैं ग्राफ में नीचे, और जर्मनी में अभी भी जो है डाउनवर्ड नहीं शुरू हुआ ट्रेंड, अभी भी केसेस बढ़ रहे हैं। वहां लगभग 1,64,000 केसेस जो है 7 डे एवरेज इस हफ्ते की जो है जर्मनी में देखी जा रही है। ऐसे ही रशिया में भी न्यू केसेस अभी बढ़ रहे हैं, जापान में भी बढ़ रहे हैं। तो ये हमने देखा जर्मनी, रशिया और जापान के केसेस जो है इसमें बढ़ोतरी देखी जा रही है इस हफ्ते। थाईलैंड में हम कह सकते हैं कुछ दिन और देखने के बाद चलेगा पता कि डाउनवर्ड ट्रेंड है या प्लेटू मेंटेन्ड है। बांग्लादेश में डाउनवर्ड ट्रेंड शुरू हो चुका है। ये ग्राफ में हम देख रहे हैं कि डाउनवर्ड जो है एवरेज वीकली, ये जो डार्क लाइन है ब्लू, ये नीचे की तरफ आनी शुरू हुई है। पाकिस्तान में भी का जो है केसेस लगभग नंबर कम है, पर अभी जो है डाउन लग रहा है कि डाउनवर्ड ट्रेंड वहां पर भी शुरू हो चुका है। ऐसे ही अगर हम देखें हमारे देश में अलग अलग स्टेट्स में कर्व जो है, महाराष्ट्र में डेफिनेटली कम हुआ है। तो सबसे ज्यादा कमी जो देखी जा रही है वो दिल्ली स्टेट में है। दिल्ली में जो केसेस जो हैं वो बहुत कम है। अब तो पिछले 24 घंटे में सिर्फ 2,683 केस रिपोर्ट हुए हैं। ऐसे कर्नाटक में भी अब कमी देखने को मिल रही है। और केरला एक ऐसा भी स्टेट है जहां लास्ट 24 आवर्स में 51,887 केस रिपोर्ट हुए हैं और 1,205 डेथ रिपोर्ट हुई हैं। कर्नाटका में भी जो है, जो कि ट्रेंड डेफिनेटली डाउनवर्ड है, लास्ट 24 आवर्स में 14,366 केसेस और 58 डेथ। राजस्थान में डाउनवर्ड ट्रेंड आप देख रहे हैं। मिजोरम में अभी जो है, हालांकि नंबर बहुत कम है, पर अभी वहां डाउनवर्ड ट्रेंड शुरू नहीं हुआ। मिजोरम में भी आप देखेंगे केसेस अभी बढ़ोतरी की ओर है। गुजरात में भी डाउनवर्ड ट्रेंड शुरू हो चुका है। वेस्ट बंगाल में तो बहुत ही ज्यादा केसेस कम हो गए हैं अब। तो ओवरऑल हम देखें कंट्री में आज की डेट में लगभग 86.5% ऑफ द हॉस्पिटल बेड जो थर्ड वेव में तैयारी की गई थी वो अभी खाली पड़े हैं। डिफरेंट स्टेट्स में आप ये देख रहे हैं कितना ऑक्यूपेंसी, कितने बेड्स हैं और कितने कैपेसिटी और परसेंटेज ऑफ बेड्स जो कि वेकेंट पड़े हैं। हमारे देश में एलिजिबल लगभग जो है 75%, 75.1% एलिजिबल पॉपुलेशन जो 18 साल से ऊपर की है वो फुली वैक्सीनेटेड हैं। उनको दोनों खुराक मिल चुकी है और 95% एलिजिबल एडल्ट्स में कम से कम एक खुराक वैक्सीन की लग चुकी है। बच्चों में देखें जो 15 से 18 साल में शुरू हुआ था प्रोग्राम, उसमें भी लगभग 62% लोग बच्चों को वैक्सीन दी जा चुकी है। तो और जो ये बचे हुए हैं, ये बहुत जरूरी है इस स्टेज में कि अभी थर्ड वेव डाउनवर्ड ट्रेंड है, समाप्त नहीं हुई है। ये वैक्सीनेशन स्टेटस ही है जो हम लोगों का बचाव कर रहा है कि एडमिशन इस वेव में बहुत कम देखी जा रही है। तो जो ये बचे हुए हैं, अभी 75% फुली वैक्सीनेट हुए एलिजिबल अडल्ट्स। बाकी जो बचे हुए हैं उनको जल्दी से जल्दी ये वैक्सीन की खुराक अपने लेनी चाहिए, ताकि ये कोविड का जो है वेव ये समाप्त हो और कोविड एप्रोप्रिएट बिहेवियर। अब ये ना लोग सोचें कि अब 2 हफ्ते से डाउनवर्ड ट्रेंड चल रहा है तो अब जो है मास्क की जरूरत नहीं है। इस भ्रांति को कृपया ना अपनाएं। अभी भी हम जो है बहुत खतरनाक पीरियड से गुजर रहे हैं। इस टाइम अगर हमने कोविड एप्रोप्रिएट बिहेवियर और वैक्सीनेशन की तरफ जोर लगाया तो फिर पूरी उम्मीद है कि कोविड का हम जो है ये चैलेंज जो है हम इस टाइम भुगत रहे हैं, इसके ऊपर कंट्रोल कर लेंगे। अदरवाइज फिर ये कोई ना कोई और वेरिएंट और ये दोबारा से केसेस आने शुरू हो जाएंगे, क्योंकि अभी जो है सिर्फ अर्बन एरियाज में से ही डेफिनेटली कंट्रोल हुआ है। रूरल एरिया में केसेस अभी बढ़ोतरी की ओर हैं। इसलिए बहुत जरूरी है, चाहे कोई भी एरिया हो, चाहे वो शहर के हों चाहे वो गांव के वासी हों, सब लोग अपना वैक्सीन की तरफ ध्यान दें। वैक्सीन जो डोज है, जिसकी जो भी सेकंड डोज है या जिसकी बिल्कुल नहीं लगी है वो फर्स्ट डोज लगवाएं, या फिर बूस्टर जो अब शुरू हो चुका है, जिनकी बूस्टर अभी बची हुई है वो लगवाएं। और कोविड एप्रोप्रिएट बिहेवियर, खासकर मास्क का इस्तेमाल जब आप घर से बाहर निकले जरूर करें। धन्यवाद। ओवर टू चावला जी।
थैंक यू डॉक्टर कालरा आज के इस अपडेट के लिए। Now we'll move to the second part of today's session. That will be taken by our known familiar face, Dr. Anjali Agarwal, and that session will be on safe rehabilitation during long COVID. You all know she doesn't need much introduction. She's our old and known face. She has been participating in all our programs. She has special interest in cardiac rehabilitation. She has done a lot of work in women's health, pelvic floor physiotherapy. She specializes in body biomechanics and sports medicines. Without wasting much time, I'll now invite Dr. Anjali Agarwal to kindly take over the floor and let's move forward. Over to you, Dr. Anjali, and welcome to the show.
Thank you, Chawla ji. Thank you, Dr. Kalra and Heart Care Foundation India and Dr. KK for such a lovely platform for us to come and help everybody globally. Today's topic is of much interest and quite a new topic to talk on, and it's around safe rehabilitation for long COVID. तो कई सारे लोगों को during the first wave or second wave, after 4 or 5 months, उनको एक बहुत ही different forms of symptoms नजर आ रहे थे, and they were not getting clue to ये क्या problem है इन्हें. Like sometimes they were going to several doctors and clinicians, and we still didn't have an idea as to how to help these patients. So we around the world who were like treating these patients, we came up with an idea to get around and form a committee to help design a program which is called Safe Rehab for Long COVID. Now, long COVID के बारे में आजकल बहुत न्यूज़ में चर्चा है. WHO has also talked about it, and we are looking at कि Omicron के बाद क्या होगा, will people get long COVID or not? But हमको first wave, second wave में definitely काफी सारे patients को long COVID के problems दिखी है. And I'll run through what all the basic issues which I have been seeing. Okay. So मैं F5 कर रही हूँ. Right. So that's my introduction, and I've been doing a lot of telehealth also with regards to long COVID rehab. If people are not able to go to the clinic and understand what the symptoms are, and coming to the message which I want to give is physiotherapists play a very important role in the rehab of the long COVID, and it is important that the goal is safe and effective, and we have to look at the complexity and the variability of those with long COVID. Now, the purpose of this talk is also to highlight that what physiotherapists, healthcare providers, doctors, patients should look at in symptom management and solely not push patients for physical activity. Because generally हम लोग देख रहे हैं आजकल के दौरान में that COVID rehab में, hospitals में and everywhere, they are just pushing patients for activity. You have to exercise, you have to exercise. Doctors are telling everybody, you got to do yoga. But there's a lot of substance and a lot of things which are taboo in these kind of scenarios of long COVID. I will run through those little highlights as to what we should not be doing and what we can do. Now, safe rehab is an approach for people with long COVID, which has been designed by the physios all around the globe. And the message is the road to recovery is very, very easy, but for many, it's a topsy-turvy curve. So the common symptoms which we see in cases of long COVID is a lot of fatigue, a lot of shortness of breath, joint pains, chest pain, constant लोगों को लग रहा है कि मेरी छाती में सीने में दर्द हो रहा है, especially right side में pain हो रहा है, lot of symptoms of long standing cough, loss of smell, which has been there in the second wave and in the first wave, Sika syndrome like dry eyes, which is mainly common with Sjogren syndromes, runny nose, red eyes, headaches, lot of headaches and sputum protection, lack of appetite, sore throat, vertigo, and a lot of muscle pain and diarrhea. The common phenomena which I will touch today is on the fatigue part and also on the shortness of the breath, which are the common thing which I'm seeing in patients who are turning up in the clinical practice, and they are reporting that उनको कोई भी solution नहीं मिल पा रहा है इन सारी problems का. And most of the time, the term which is being told to them, it's all in your head. It's all in your head, and that's when people are being sent back and saying that this is all your anxiety which is showing up as after the COVID scenario. But this is not the case. Now, the post-exertional symptom exacerbation. So, काफी सारे हमारे COVID patients जो recover हुए हैं, जिन्होंने first 5 to 6 weeks or during the recovery अपना ध्यान नहीं रखा है, they've gone back to working hard, they've gone back to exercising in a very real, tough way, have actually brought them down with post-exertional symptoms. So उनको अपने रूम से किचन तक जाके खाना बनाने में भी they feel breathless, they feel they go out of breath, and they feel that they're not able to resume their activities or daily living without discomfort. So it is very important that वो लोग अपने symptoms को monitor करें carefully, and in days and out में अपनी physical activity को monitor करके आराम से get back to activities of daily living. So it is not a jump to the Mount Everest. I always tell people is take your time, pace yourself, recover slowly, and then gradually build your speed and gradually build your capacity to return back to activities of daily living. अब एक दिन में ही बहुत सारा खाना बनाना है या they have to do a lot of things in a task. Prioritize the most important task in a day. Minimize your goals of life for a month or for a year. So इस way में your recovery is smoother and is much, much linear in nature rather than a topsy-turvy curve. Common phenomena we also see in the cardiac impairment, which is the physical deconditioning in these patients, and a lot of cardiac dysfunction, which is affecting their physical activity. So many times patients are calling me, Dr. Anjali, I've been pushed to exercise by a clinician and my heart rate really races up, it really goes up. मैं जब उठती हूँ अपने बेड से या मैं अपने चेयर से उठती हूँ तो I feel dizzy, I feel like I'll fall down. मेरा heart rate is just rocketing up to 120, 130 or 140. But then also people are just pushing me for exercise. I feel that there is something really missing in the big picture. Now, this is a little thing which has happened, and she has felt quite sad and quite, like anxious in the moment because she feels that she's been left behind while other people have progressed. So the word of message for people is not everybody is the same, not everybody.
Dr. Anjali, unmute yourself. You are muted.
Yeah. So main thing is never try to compare yourself with any other person. Your family member will be different from yours. आपकी recovery, उनकी recovery में काफी difference है. Even though you're eating the same amount of food, same amount of diet, because everybody's body's parameters, inflammatory markers पे काफी सारा long COVID depend करता है. Now, this is a very gross term which we see in autonomic nervous system overdrive. So, a lot of long COVID scenarios में हमको ये दिख रहा है कि there is a overdrive of the autonomic nervous system, and the signs and symptoms of it is grossly orthostatic intolerances in response to physical activity. So, it's a common phenomena. मेरे कई सारे patients भी सुन रहे हैं यहाँ पे, उनको ये बोलते हैं कि मैं उठ के खड़ी होती हूँ, मेरे को चक्कर आ रहा है, मेरे को लगता है मैं गिर जाऊंगी. There have been episodes where my patients have told I've fallen 10 times in a day. मैं उठ के चल रही हूँ, I'm going to office, I'm trying to resume my work, but I feel total brain fog in front of me. I cannot concentrate and look at the screen. I feel like I'll just collapse. And I feel my heart is pumping very hard. My heart rate is just going up and is not in control. So these are all the symptoms of autonomic nervous systems, जिसके बारे में और मैं बताऊंगी कि what all we are doing to help patients of people who have suffered from COVID and how they can recover in a very smooth way. Now, SARS-CoV-2 has also affected the autonomic dysfunction, which also presents as one of the signs and symptoms as breathlessness. So, काफी सारे people who had very good exercise tolerance were marathon runners, was having to run, like they can run for 42 kilometers or 21 kilometers in a very good span of time, now present with something called as long-standing breathlessness. They can't even walk a mile without going breathless. They have extreme fatigue and chest pain, and they feel syncope, which is when they get up, they feel like they'll just faint and fall. And there's a lot of exercise intolerances in patients with long COVID. Because of this, many of these patients also suffer from muscle mass loss and total deconditioning of the body because their body is not being able to tolerate any forms of exercise. And as a result, it has a cycle which forms a loophole for them, whereby the body deconditioned because they're not able to exercise good and the muscles are going wasted, thereby building up more high risk factors for developing diabetes at an early age. And then it's a cyclic form which is going on for many of them. So we have to address that they should be able to exercise, but the safe way to get rehab and to get back to action in a very smooth way. Now, thoughts. This is a favorite word which I keep talking in the time once the second wave got over. And it is a big elephant in the room. So it is a term which we call as dysautonomia. It's an umbrella term. In iske andar we have autonomic nervous system, which can affect our postural tachycardia, inappropriate sinus tachycardia, and vasovagal syncope. Emerging evidence is also present that orthostatic intolerances and postural orthostatic tachycardia among the long COVID patients also have symptomatic changes with the heart rate and the blood pressure in upright positions. तो ज्यादातर पेशेंट्स की कंप्लेन है कि जब भी हम सिटिंग टू स्टैंडिंग में खड़े होते हैं हमारी प्रॉब्लम्स एग्रीवेट हो रही है. Why is it so? People are not able to get the answer yet. Now, what is ANS? हमारा ANS क्या काम करता है? What is the ANS doing? Now, ANS is divided into sympathetic systems and parasympathetic system. So we know that our heart rate, our blood pressure, our dilation of our bronchioles, the kidney functions, the peritalosis or the digestion, all these activities depend on the sympathetic systems. जहाँ पे हमको cool down करना है, we are trying to like sleep, when we try to, relax ourselves, that's the parasympathetic systems of the body. Now, both these two symptoms are very essential to work in a sync. Now, many times in the cases of COVID and when people have a cytokine storm, we see that the person is in a constant fight and flight syndrome. So it's almost similar to कि मेरे को डर लग रहा है. And when you are fearful, you are actually kind of letting your fight and flight response get heightened. And your adrenaline getting heightened, that causes your sympathetic system to be supercharged, while your parasympathetic system, जो आपको अच्छे से सोने देता है, it helps you to sleep well, it helps you to digest your food well, it helps you to calm down further and brings your heart rate down, is not getting activated. So this is a common phenomena we are seeing in COVID patients and also in cases of post-recovery and long COVID patients. So unka sympathetic system is very high charge versus the parasympathetic system. Now, what is the solution for it? What do we say? Like, do you start thinking positive to help it? But there's so many factors which are influencing our ANS in cases of long COVID. Now, screening of the POTS. How do we screen the POTS? So generally, the cardiologists are the first people to be able to screen, but many times we as physios who have been trained in long COVID are doing it in clinical practice. The basic practice which we do is to screen for orthostatic hypotension and the heart rate differences, which is called the NASA 10-minute lean test and the active stand test. Now, the active stand test measures the blood pressure and the heart rate after 5 minutes of lying supine and then 3 minutes of standing. The orthostatic hypotension is defined as a fall of 10 mm mercury systolic and 10 mm mercury diastolic after standing for 3 minutes. Now, the health tilt at least to 60-degree angle, and the diagnostic criteria for POTS is the heart rate jumping greater than 30 beats per minute within the 10 minutes of standing or a head tilt. In the absence of orthostatic hypotension, the COMPASS 31 score is a questionnaire that can help us identify the autonomic dysfunction. So the range of heart rate parameters such as heart rate variability, heart rate recovery, heart rate acceleration may also approach to assessing the cardiovascular autonomic regulation. So ज़्यादा से ज़्यादा हम patients को हम online भी we are trying to able to gather information of somebody who's always complaining that they have tiredness, they have fatigue, they're feeling dizzy, or they have some awkward feeling where they feel there's palpitation. If we run these tests on an online medium also, we're seeing there's a gross difference of 30 mm beats for a patient who's lying supine and then he is standing up. This kind of heart rate variation I'm seeing in plenty, not just with one person who's in the family, but even the small kids and the children are also getting affected. So कभी कभी ऐसा भी हो रहा है कि कोविड हुआ भी नहीं है, उनको पता भी नहीं चला है, they've been asymptomatic and yet we are seeing a lot of symptoms of POTS. So we are not able to connect the dots as to why it's happening for them, but definitely we have to rule out that asymptomatic COVIDs are getting long COVID also. So the common test I think all the doctors in the clinics and hospitals do is the tilt table test, where the doctor will secure you on a flat table and you are plugged onto an ECG, blood pressure monitor and a pulse oximeter. The vitals are monitored and the table is tilted to about 70-degree angle in standing, and the vitals are monitored for 10 to 60 minutes. This is the common tests which are done in all cardio exercise physiology labs, and if they're not been done because we have a lot of patients all over India in the rural settings जहाँ पे उनको approach ये नहीं मिल पाएगी, so we can do it online just with sit to stand test or lying supine to stand test of lying down and then standing up and measuring your heart rate. That is again a very worthwhile way to know how you are having a heart rate which is varying or whichever is contributing to the issues. The most common patient-reported outcomes are the self-evaluation of breathing. We have to ask them how they breathe, how well they feel that they're able to breathe. Are they feeling breathless? Are they able to walk for 6 minutes without going out of breath or without letting the oxygen fall within the 6 minute time period? Multidimensional fatigue index. So multidimensional fatigue index में if they are going and working in the kitchen for 10 minutes, उसमें उनको क्या feeling आ रही है? If they are going to the market to buy stuff, what they're feeling? If they're going to exercise, what they're feeling? All these are the fatigue index which we can capture and understand how the patient is progressing for us. Now, the default symptom question is again another symptom question we ask them is throughout the day, कई बार इन लोग को रात को नींद नहीं आती है. They suffer from insomnia. They have high grade palpitation only when they have sleeping in the night. And many times they're also talking about food allergies and a lot of mast cell activation syndrome, which I'm seeing along with POTS in most of the long COVID patients. Now, the post-COVID functional status is a groundbreaking rule because we know that they have revived from COVID, they have recovered from COVID, but how's their muscle mass, how is their breathing score, and how is their functional abilities, which will help us to make a plan of action for each of our patients. So the autonomic nervous system and orthostatic intolerances may BP or heart rate को screen करना है. Active stand test where the BP and the heart rate, 5 minutes of lying, 3 minutes of standing. Look for breathlessness, look for palpitations. If you're feeling faint, you have the answer to. Consider non-upright isometric exercises and compression garments. These are the three things which we are dealing with a lot of patients with complaining of orthostatic intolerances. सारी exercise उनको non-upright way में करनी है, which could be in sitting or kind of semi-reclined or lying down situation. Every exercise is isometric, where we contract our muscles or we try to hold a muscle in certain positions. And compression garments. These are helping to maintain the blood volume, which gets pooled in the legs because of the orthostatic intolerances. Another thing which we do is the autonomic conditioning therapy, which is a proposed novel adapted long COVID rehab protocol among the autonomic dysregulations. That includes a lot of breath work. So the way we breathe, it's getting affected in many of the times of people who have recovered out of COVID. And that is especially because when they get COVID, the certain part of the lung functions or the diaphragm is not able to get activated, and they're not able to breathe in a way where they can trigger off the parasympathetic mode of breath work. So we do a particular kind of breath work where we don't concentrate of exhaling deeply, but there's a lot of work on exhalation, which helps to calm down your systems. Then a supine active range of exercise, which is लेट के ही हमको सारी एक्सरसाइजेस करनी है शुरुआत में. जब कोविड हुआ, हम कोविड से रिकवर कर रहे हैं. Do not jump to doing सूर्य नमस्कार in standing because there's a change of posture. और जहां पर हमारा posture में हम नीचे जा रहे हैं, फिर ऊपर खड़े हो रहे हैं, we are changing this position. It will affect the heart rate, will affect the blood pressure, and that will cause more issues with a long COVID scenario. Now, so it is very important that sustained symptom stability, introduction to titrated submaximal aerobic exercise is also considered. So we have to do aerobic conditioning, but we have to understand how much is safer for a particular individual. So yes, sari conditioning has to be done under a supervised physiotherapist who's trained in long COVID, because not many exercises we give are safe for people who are recovering with orthostatic intolerances. So another thing we see is the exercise-induced desaturation. As I've told it, many of the people who were very athletic in nature, they could run marathons, they could actually climb, rocks. There's a lot of rock climbers which I've seen. They've been affected with this kind of deconditioned exercise-induced desaturation. mainly because the SARS-CoV-2 affects the endothelial lining, and it causes endothelial dysfunction, leading to increased thromboembolic complications. Now, the low oxygen saturation after exertion is observed in people with acute long COVID, and which has been seen with resting oxygen saturation falling down, degree of dyspnea, which is आपकी कितनी breathlessness score हो रही है, feeling unwell. So assessment of the oxygen saturation with COVID-19 is recommended during hospitalization, before discharge, and after discharge for people who have acute COVID-19. Now in Omicron, we don't see so much of fall of the oxygen sats, but in many of the cases with people with long COVID comorbidities, we still have to keep a watch on their recovery, and especially with the elderly, we have to keep in mind that we are measuring their dyspneic scale, we are measuring their exertional scale, and at least for 2 to 3 weeks, we should not be pushing them for high load of exercises, which could include Surya Namaskars and standing. So one can do Surya Namaskars in sitting, which is much safer. So we are doing everything in sitting, semi-reclined, or lying down for many of the people who have recovered. Now, even the presence of exertional desaturation, people tend to hyperventilate. So we have seen a lot of patients who had, the parameters where the lung was affected, they tend to hyperventilate. What do you mean by hyperventilate? We breathe in a lot of oxygen, but we are not able to exhale out. And as a result of that, you keep breathing in, and you kind of puff up your lungs so much that you cannot have the adequate amount of oxygen to carbon dioxide balance. And that also increases your respiratory rate and the tidal volume during the exercise. So many of the times, these hyperventilation syndromes are because of biochemical, they are because of biopsychosomatic or biopsychological. So when you are in a flight and fight syndrome, where you feel that you're fearful, जब आपको लग रहा है कि आप डरे हुए हो, आपको बहुत भय लग रहा है, तो आप अच्छे से सांस नहीं ले पाते हो, आप सांस रोक लेते हो, and नहीं तो जोर जोर से you take lot of breath in one go. All these activities are not healthy for helping you come out of this COVID. So the underlying mechanism which deprives hyperventilation in long COVID is still unknown, but we are trying to find more loopholes, and we have more research data and scientific studies which are telling us that the symptom of flight and flight syndrome, the ANS getting triggered, the sympathetic system is working so dominantly that people are not able to kind of dominate the parasympathetic mode. Now, clinicians should consider the possibility of hyperventilation, and thereby they're compensating the impaired diffusing capacity of the lung, carbon monoxide, or the air trapping. So many times they'll say that there's a lot of puffiness in the chest feels real tight. These are the possible symptoms that your patients or anyone is kind of hyperventilating. So the word of advice is fatigue management. The first thing we have to rule out is जिन लोगों को बहुत थकान महसूस हो रही है, बहुत ज्यादा fatigue मचे रही है, तो stop, rest, pace. We cannot climb Mount Everest in a day. Let's build our life in many goals and have a goal of stop, rest, pace. जहां भी हमको थकान लग रही है, stop, take a nap, सो जाइए आप. आपको लग रहा है रेस्ट लेना है तो रेस्ट लीजिए. पेस करना है, आपको वॉक करना है. सपोज आज मैंने आपको एक गोल दिया कि आप 1 किलोमीटर से 2 किलोमीटर वॉक करें, तो आपको लग रहा है कि आपकी ब्रेथलेसनेस आ रही है और आपको लग रही है थकान, तो आप 1 किलोमीटर के जगह 500 मीटर अपनी चले, आप रुक गए, बैठ गए, थक गए, थोड़ा पानी पिया, एंड देन आपने you go on and walk again. This way you are trying to achieve the goal, but in a very targeted pacing manner. इसको हम pacing बोलते हैं. Pacing का मतलब है थम जाइए, रुक जाइए जब आपको जरूरत है, बिना like have a target in mind, but don't run for the target, because your body is telling you and signaling you, please listen to the body. Respiratory breathing regulation and cough management. आधे से ज्यादा लोगों को cough is because they're not able to kind of expel out the mucus or sputum. So we train them, and we train all the respiratory muscles, how they should be breathing and how to clear off the mucus so that they can clear off their lungs very well. Autonomic response monitoring, which has been, we support the patients in monitoring their pulse rate, blood pressure, monitor their activities, what is causing the problem. When they stand up, there's a way to teach them how to stand up. आपको जब उठना है तो count 1 to 10, slowly try to get up, don't just jump down and sit down. Exercise prescription when appropriate, and always support and advocate the red flags. It's very important that we have to ask the patient, did you feel good today? How was you feeling today? That's very important in the long COVID scenario, because it's not a very easy curve and not a very easy life for many of them. I'm seeing like there's a gross response we see all over the world now, and we see so many lives being affected because of long COVID. So very important thing is the active cycle breathing, which I have been teaching to most of the COVID affected people, and also those who are recovering. And if you feel that there's loss of mucus around your neck and throat, you need to understand that always purse your lip and try to breathe out. When you do a controlled breathing, you don't tend to hyperventilate. अगर हम बहुत जोर से सांस लेंगे, we tend to always make a mistake of hyperventilating. So purse your lip in a controlled breath, deep breath, purse lip, breathe out, deep breath, and purse lip, breathe out. And try to do the huff, like ha, ha, ha. So this kind of breathing we keep teaching to a lot of people, and this way you're trying to open the air passages, and the oxygen diffusion is very efficient and very good. In a similar manner, when we see patients with COPD and asthma, what is the difference between people with COVID is we have lung fibrosis, where the scarring of the lung tissue is not letting the alveolus to open up. So we want to activate the opening of the alveolus. In cases of asthma and COPD, they are already hyperventilated. So we don't tell them to inhale a lot, we tell them to exhale a lot. So that's a different breathing concept we see, and every person is so specific, and we see 1-to-1, and then we can guide them as per. But always remember never to take a very deep breath just normally. Just take a small deep breath through your nose and then try to purse and breathe out. That is called as the purse lip breathing, which is very, very effective to calm down the sympathetic system and supercharge your parasympathetic mode. So the physical activity in the young people, if we look at, expectation reality mismatch is always there. Minds aim unreal physical function. So expectations are high. Don't equate it that we will return back to normal in a short period of time. So long COVID, people have been affected. मेरे पास अभी भी patients हैं जो 2020 March and Jan से affected हुए थे, and अभी तक they are still having the symptoms of long COVID. So long COVID is a very big loophole which we actually fall into. We don't take care of our recovery in the post-COVID a few weeks of the time period. So the early intervention exercise plan always is, let your patients tell you how much forms of exercise they can tolerate, which are concentric in form. We are not trying to expand things, we're trying to contract things. By doing it, we hold in more blood pooling in important parts of our organs. 80% of the low oxygen requirement compared to concentric exercises. Very important. Now, the safe, effective way of treatment to decrease the compromise of muscular cardiac decondition, strength and size of the muscle can build in short period of time, keeping safety in mind compared to concentric work during period of rest and early mobilization. So we are all talking about early mobilization, get back to walking, get back to running, but everybody is different. So have a specific goal, plan with your physiotherapists, trained in long COVID, and they get you back into forms without risking your orthostatic intolerances. So the physiology of the disease is real, impairment of the organs are real, symptoms are true, emotions are uncertain, nobody understands what is going on, and a clueless feeling. This is a common phenomena all the healthcare providers will come into. We hit a dead end where we say that we're not able to get any answers for our patients with long COVID. So life in general, our plan is that the road is smooth in front of us. We want to see the goal, but in reality, it's a topsy-turvy curve. So it's not a linear curve, it's up and down, but We will get there. The message is that keep holding on to your faith, keep doing right things in a right way, in a proper way, and we will soon get there. So return to exercise, we have a clinical progress, then we have return to function, and then we actually return to exercise. So it's in a phased out manner. So anywhere where saturations are going, then 96%, we will have to laterally time it out and build your capacity to exercise through pulmonary rehab and through cardiac rehabilitation. So the new onset of shortness of breath, chest pain, tightness, pressure and sensation, syncope, drop in the blood pressure, all these activities have to be monitored before we let you progress to goal 2 or goal 3. Now, symptoms of myocardial injury, myocarditis, thrombolytic injuries or disease, we have to look for these criteria in hospitalized patients, patients who have been bedbound after the infections, and patients who have uh, required cardiac and respiratory monitoring and evaluation starting of the exercises. So it's a very phased out manner, and we cannot push anybody and everybody to goal 3 at one go. So we have to go out from goal 1 to goal 2 and goal 3. जैसे अपने क्लास में हम क्लास 1 से क्लास 2 क्लास 3 में प्रमोशन पाते हैं, उसी वे में our body will also promote and reach goal 3 in a phased out manner. So that's about it. Thank you everybody for listening, and I'm open for questions now.
Hello.
Thank you,
Keshav ji.
Dr. Anjali. We just ask questions. Let us go back to the standard this thing. Those who want to ask their questions, they may kindly raise their hands, and we'll ask you one by one. You can ask your questions.
Yeah.
At the outset, I'll thank Dr. Anjali, but I'll say the session was very exhaustive and very technical. In fact, it should have been, we expected it to be very simple and in a layman's language. This time it was very technical. It seems that all our health educators are also partly doctors, so it was good for them, but for general public it was highly technical. So Keshav ji wants to ask some question. Keshav ji, unmute yourself.
नमस्कार डॉक्टर अंजलि।
नमस्ते।
तो
केशव जी कैसे हैं?
अच्छा है। मेरा my issue is not about cough or breathlessness nor any other issue. Issue is that one lady about 58 years old, उसका वो 1 महीना हो गया कोविड हो गया, it is more than 1 month, but इसका main issue is that at night time and sleep उसका nose is getting blocked. उसके लिए एलोपैथिक दवाई दिया था, that is xylometazoline first or sodium chloride solution, but it is not working. So if you kindly advise me, it will be helpful.
Okay, so Keshav ji, first of all हमको ये देखना है कि उनको ऑक्सीजन कितना हो जा रहा है जब वो लेट रहे हैं. When she's supine, many of these patients are also reporting something called as sleep apnea. As I said, many of them are hyperventilating, मतलब कुछ सांस ज्यादा ले पा रहे हैं, but सांस को exhale नहीं कर रहे हैं. So it looks like more like a breathing discomfort or a breathing mechanism impairment. And isko thoda rectify karne se, they will start to breathe better, and the nose block and everything, all these symptoms will go away too.
Okay.
ठीक है, तो उनको बोल सकते हैं कि पर्स लिप ब्रीदिंग करें, जैसे कि मैंने बताया कि lips को close करके exhale out very slowly in the night, and try to more sleep on the left side of the body basically.
Okay.
And raise your head end. Basically you can have 2 to 3 pillows, and that helps to reduce the complexities of sleep apnea, which I see most of the long COVID people having.
Okay.
ठीक है ना?
Okay, thank you.
Thank you.
Can I ask a question, Doctor?
Before I ask Geeta ji, I'll ask one question from Mr. Vijay Gopal to ask. Let him ask first. Ji.
Yeah, thank you, Doctor. An excellent session, but I joined late. Primarily, I wanted to check up regarding the mental health. In fact, yesterday we heard in the budget also they're setting up about 23 centers in the country, I believe, on the mental health. But not much has been done except a few conferences or seminars and all.
would you like to touch something on the mental health?
Yeah.
Particularly senior
Thanks.
citizens.
Yeah. So anybody who's recovered out of COVID, it has actually, as I said, in the ANS, which is the autonomic nervous system, it affects a part of our sympathetic system, and our parasympathetic system is in charge for our mental health. How we feel, how we sleep, everything is affected our mental health, and which is primarily affected because of our parasympathetic overdrive ko hum log nahi la pa rahe hain. So you have to understand that many of us who have been working on the long COVID patients, we do address the mental health. That's why we ask the functional status of the person and the quality of life of a person. And we definitely give them cognitive behavior therapies, and a lot of things get changed when we condition their autonomic nervous system. Thereby, we are addressing the vagal nerve and vagal nerve droning. Basically, पहले डॉक्टर के अग्रवाल भी हम लोग को हमेशा हम लम बोलते रहते थे, right? That is something which is very, very effective. So anybody who's affected, my word of advice is hum, sing a song. आप जितना आप गाना गा सकते हो, and add some things which will increase your ability to get recreated. Netflix लगा के movies नहीं देखिए, but sing a song, dance करो आप थोड़ा सा, जितना भी कर सकते हो बैठ के dance करो, read a Gita, read any kind of poems which you can speak loudly. All these things will affect you in a mental health and will help you recover faster and better. Believe it or not, all my patients are doing very good just by humming. And I follow Dr. K.K. Agrawal's mantra only, and that's what I am giving to all my patients too.
Thank you. Thank you very much.
Thank
Geeta,
you.
please, Geeta Khilani. You may unmute yourself.
Hello.
Yes,
Yeah,
please.
Dr. Anjali, it was a nice
Hi.
presentation, but it was totally English and on medical terms, which is really little difficult kun logon ke samajhne ke liye. So I would request you to give 5 take-home messages from your presentation. कोई भी 5 post COVID rehab के लिए आप हिंदी में, simple हिंदी में समझाएं. What is the take-home message from your presentation? Thank you.
So take home message सबके लिए ये है कि कोविड की रिकवरी के समय आपको अपने खान पीन का, अपने रेस्टिंग का बहुत ध्यान रखना है. प्राइमरीली बहुतों को जो फीलिंग हो रही है, अगर किसी को फील हो रही है कि उनका चेस्ट की धड़कन बहुत बढ़ गई है, जब वो सो रहे हैं और अचानक से खड़े हो रहे हैं, उनको लग रहा है कि सीने में दर्द हो रहा है, या चक्कर आ रहा है, ऐसा लग रहा है कि हार्ट बहुत तेजी से दौड़ रहा है, ये सारे सिम्टम्स लॉन्ग कोविड में देखे जा रहे हैं. अगर आपको ऐसा दिख रहा है तो प्लीज आप अपनी एक्सरसाइजेस को गाइडेंस में करिए, जो कि लॉन्ग कोविड फिजियोथेरेपिस्ट हैं, और या डॉक्टर से जाके मिलके उनकी एडवाइस के थ्रू करें, ना कि आप कोई भी एक्सरसाइज करना स्टार्ट कर दें. बिकॉज इससे क्या हो रहा है कि कुछ लोग अपने हार्ट रेट को इतना बढ़ा दे रहे हैं, दैट कॉजेज योर सिंपैथेटिक मोड टू गो सो हाई, एंड उस कारण से people are not able to calm down, and they're having a lot of issues with heart rate imbalances and blood pressure not getting control. तो अगर आपको अपने सारे सिम्टम्स को calm down वे में हल करना है, सारी एक्सरसाइज आप जितना बैठ के कर सकते हैं, जितना लेट के कर सकते हैं, in the first 4 to 5 weeks, जब तक आपको नहीं लग रहा है कि you are able to catch up with time, जब तक आपको लग रहा है कि आप और ज्यादा एक्सरसाइज लोड नहीं ले सकते हैं. अगर आप किचन में काम कर रहे हैं, अगर आप कोई भी ऑफिस का काम भी कर रहे हैं, तो कंप्यूटर के भी काम थोड़ा आप टाइम भी करें. मतलब ये नहीं कि एक ही बार में बैठ जाए 9 से 6 तक. मिनी ब्रेक्स लेना है, मिनी खाना खाना है, सो दैट योर पैरासिम्पैथेटिक सिस्टम हमेशा चार्ज रहे. और इंक्रीज योर वाटर इनटेक. सो पॉट्स वाले पेशेंट्स में हम ज्यादातर देख रहे हैं कि पानी की कमी और नमक की कमी बहुत देखी जाती है. सो इंक्रीज योर वाटर एंड सॉल्ट all intake, and that has helped considerably to my long COVID patients. Thank you, Geeta ji.
Shrikant Kumar, please ask your question.
Yeah, good afternoon, ma'am. मेरा क्वेश्चन लोअर बैक पेन रिलेटेड है, तो इसका कोई लिंक है क्या लॉन्ग कोविड से? क्योंकि मुझे कोविड हुआ था, 1 साल होने जा रहा है, अराउंड 9 मंथ हो गए, और बैक पेन ये 4 मंथ से 4 मंथ से बहुत ज्यादा हो रहा है लोअर बैक से.
Yeah. सो श्रीकांत जी, हम लोग ने देखी है काफी सारी स्टडीज में जहाँ पे लॉन्ग कोविड और कोविड के बाद वी हैव ऑटोइम्यून आर्थराइटिस, वो काफी सारे पेशेंट्स पे हमको पॉजिटिव दिख रहा है, जिसमें हम एक ब्लड टेस्ट बोलते हैं ANA और CRP, ये आप करा सकते हैं। एंड आप किसी रिमेटोलॉजिस्ट से भी मिलके एंड फिजियोथेरेपिस्ट के थ्रू यू कैन गेट अ गुड आंसर फॉर योर बैक पेन और एनी काइंड ऑफ मैनेजमेंट। तो ये लॉन्ग कोविड में हम काफी लोगों को बैक पेन्स इसलिए भी देख रहे हैं क्योंकि अगर आपका हार्ट नहीं ठीक से काम कर रहा है बिकॉज ऑफ द ऑर्थोस्टोटिक इंटॉलरेंस, जो मैंने बोला कि हार्ट रेट ऊपर नीचे जा रहा है, so the common symptom people will complain is lower back pain, leg pain, headaches. So we need to isolate कि ये पेन आपको autoimmune के कारण आ रहा है और it's also coming because of long COVID POTS.
So with this we'll come to the end of this session, but before we close, since you have reminded us our Swasth Guru Dr. K.K. Agarwal, I would request all of you to kindly unmute yourself and also switch on your videos so that jointly we can remind, you can chant Lam Vam Ram along with me. Please, videos on कर लीजिए, अपने आप को unmute कर लीजिए। सारे हेल्थ एजुकेटर्स जो मेरी फैमिली के हैं, जो मेरे साथ बहुत पुराने जुड़े हुए हैं, इस बहुत खुशी होती है सबको मिलकर, और सबको मेरा प्रणाम। और आपको याद होगा कि हम जब भी डॉक्टर साहब के सेशन में जुड़ते थे, प्लीज पीछे से बैकग्राउंड की आवाज को बंद रखिए, तो जब भी हम जुड़ते थे तो किस प्रकार से हम चैंटिंग करते थे और चैंटिंग का क्या हम पर इम्पैक्ट रहता है और किस प्रकार से हमें शांति मिलती है और किस प्रकार से वो हमें इस प्रोग्राम के आरंभ में आगाज करते थे। तो आइए मिलकर एक बार शांत मन से उनको याद करते हुए उनके इस मंत्र का उच्चारण करेंगे। प्लीज मेरे साथ बोलिए, लम अब वम बोलेंगे, अब रम बोलेंगे, रम अब यम बोलेंगे, अब हम बोलेंगे, दो बार ओम का उच्चारण करेंगे, आज केवल आपको मुझे ये चैंटिंग के जो उनके मंत्र थे उनको केवल याद कराना था, इसलिए मैंने ये नहीं बताया कि आपको किस अंग के से उसकी ध्वनि निकालनी है। सो आज के लिए इतना ही, और आपकी जानकारी के लिए मैं शेयर करना चाहूंगा कि नेक्स्ट सेशन मोस्ट लाइकली जो मेड टॉक में हमारे डॉक्टर संजय कालरा आते हैं रेगुलर, तो उनको मैंने रिक्वेस्ट किया है, कंफर्मेशन अभी नहीं आई है पूरी तरह से, लेकिन मुझे उम्मीद है कि वो मानेंगे। और नेक्स्ट सेशन बड़ा अट्रैक्टिव, बड़ा इंफॉर्मेटिव सेशन रहेगा डॉक्टर कालरा के यहाँ से। तो मैं आपसे रिक्वेस्ट करूंगा कि समय पर ज्वाइन करें ताकि हम उनसे अधिक लाभ उठा सकें। डॉक्टर कालरा करनाल में अपनी प्रैक्टिस करते हैं और एक हॉस्पिटल चलाते हैं, बहुत पुराने एंड्रोक्राइनोलॉजिस्ट हैं, और बड़ी उम्मीद है कि वो नेक्स्ट सेशन में हमें ज्वाइन करेंगे। और उसके बाद फिर नेक्स्ट सेशन में अनाउंस करूंगा। एक CPR की बात हुई थी, डॉक्टर कालरा से CPR के लिए भी बात हुई है, वो किसी भी दिन हमारा सेशन CPR पे ले लेंगे। तो इसके साथ सबको धन्यवाद, अलविदा। अगले हफ्ते इसी टाइम इसी चैनल पर नए डॉक्टर के साथ नए विषय के ऊपर बात करेंगे। तब तक के लिए अलविदा, नमस्ते, अपना ध्यान रखिए।